So sciatica is a compression of the nerve as it leaves the lower back and enters the legs or the rest of the body. So when the nerve is compressed, then there are various reasons for the compression. It could be a disc prolapse, it could be arthritis, and causing a condition called stenosis. It could be injuries, it could be tumors, it could be infection. So there are many reasons for patients to develop sciatica. So essentially, sciatica is a compression of the nerve. And when the nerve gets compressed, people experience pain along the nerve, which usually radiates into the buttock, the back of the thigh, and all the way towards the foot. So this is a gist of what actually sciatica is. Yes, at times the sciatica can present with a condition called as a cauda equina syndrome. So cauda equina means actually a horse tail. The reason it's called as a cauda equina is because the nerves, as they come out of the spine, they kind of are in a bunch, and that resembles a horse tail. Now, these nerves are quite sensitive in terms of the pressure on them. If they experience sudden onset of pressure, probably because of a disc prolapse, which is the most common cause, the patients can lose control of bowel, bladder, change in sexual function, loss of feeling in the private area. If this were to happen, then this is an emergency, and the surgery to decompress the nerves has to be done as soon as possible. If there's delays in the surgery, then the damage can be reversible. So majority of the sciatica is treated non-surgically. I would say 85 to 90% of patients do not need to have surgery. So initially, the treatment would be with special tablets, which are nerve tablets, which can help calm the nerve. Physiotherapy can be used, anti-inflammatories can be used. So this normally takes about 4 to 6 weeks for the symptoms to settle down. And in most patients, these symptoms will settle in about 4 to 6 weeks. If the symptoms do not settle and the patients have a significant amount of pain, then the second step is to offer them some certain spinal injections in the form of nerve root blocks, where I use steroid and local anesthetic, and that's given around the nerve root to block the nerve, reduce any inflammation around the nerve because of the pressure. And this can be another way of trying controlling the sciatica without necessarily going down the surgical route. Well, the most important advice is for patients to keep the core strong. So the core is the muscles of your back, the muscles of your abdomen, the oblique muscles which are on the side of your abdomen. These are your core muscles. So the muscles have to be kept conditioned and strong. Patients advised not to put on weight, avoid smoking or stop smoking. And these are some of the ways that a modification in the lifestyle can help prevent sciatica. Obviously, once sciatica is set in, then my advice to patients is avoid lifting heavy objects. Even if you do have to lift, protect your back. So there are some precautions that are normally taught to the patients by the physiotherapist, where they may be able to protect the back when they have to do, if they have to do something like lifting a heavy load, which is a part of the profession. Then there are ways of doing it, getting some assistance and aids, which can indirectly help prevent the onset of these conditions. So these are completely different entities. Sciatica essentially is a common terminology used for pain down the nerve. And the pain down the nerve could be for various reasons. It could be, like I mentioned, it could be because of a prolapsed disc, it could be because of arthritis, it could be because of a tumor, injury, or infection. So there are many reasons for sciatica to develop. Scoliosis is actually a deformity of the spine, where the spine does not have its normal alignment. So usually the spine is like an S shaped in its normal structure. So you have a curve in the lower back, which is forward, and then it becomes a backward curve, and then as we go towards the neck again becomes a forward curve. So this is a normal alignment of the spine. The scoliosis normally happens when you lose the alignment, mainly from side to side, and the bone which forms the spine, which is called as the vertebra, starts to rotate. There are many reasons for this happening. It could be something which people are born with, which is called as a congenital scoliosis, where a part of the bone forms abnormally. Sometimes the scoliosis develops as the person grows up, especially as a teenager, where there's a growth spurt and parts of the bone do not keep up with the rest of it. So one part of the bone grows, the other part doesn't, and because of that, then the bone starts to twist. So you get a kind of a curve in the spine. It looks, people get a hump, which is more obvious towards one side. There is a mismatch between the shoulder, especially girls, if they're wearing bikinis and things like that, they find that it does not fit them as well, and they are quite conscious about it. So this is another reason for the scoliosis to develop. And lastly, the scoliosis can develop also because of injuries, could be because of wear and tear in the spine, which happens later in life, or depending upon what the circumstances are. So essentially, the scoliosis is a deformity of the spine, which is more in the sideways direction rather than in the forward-backward direction.